Some of the hurdles that I think I had to get over included just being afraid, but the training from the nurses show us how to go about this and what not to do. Get a routine down. The routine that you follow each time you have a certain task helps you with knowing that you're doing it well and, of course, correctly. So I began to look at my own routines and set some up. And that includes being sort of proactive, being ahead of the curve. We order supplies every month, and for me, writing down to be sure that I get extra alcohol wipes next time or an extra syringe next time because I'm getting low. Those kinds of things I don't want to get behind on. If I know that my routine is going to be altered a bit, what does that mean? If I'm going to be out for several hours, do I have my emergency supplies with me? Showering is a big change for me. You can't have your pump go into the shower with you. It is not waterproof. Where do you put that? Another life hack that I have is hanging my pump outside of the shower door when I'm taking a shower, so I know where it is and it's safe. It's not going to fall, but it's not in the shower with me. I use a seat to sit on and a handheld shower because I can more directionally put the water where I want it to be, and I can keep this area dry. You do not want your IV site to get wet. Where do you put a pump when you're going to sleep? When I sleep, my pump goes right up under the pillow on the side in between the pillows of the bed so that I know where it is. Other people put their pumps up on the nightstand or on the headboard behind them. When I dress, I use a band that goes around your waist and it has pockets. So your pump, which is about a pound worth of pump, can fit closely in there, and then the tubing can be wrapped up out of the way. It won't be pulled on anything. And then it's also hidden under your clothing. Another life hack that I've done is I just am so glad my yoga teacher taught me squats, because leaning over forward makes us short of breath. But if you can go down a bit on your, like into a squat, bend your knees, deep knee bend, picking up off the floor, or getting my cat's food bowl is much easier for me. So, the day-to-day living with IV Remodulin calls for you to sort of be aware of things you probably never thought about before. Ask for help. Do not do this alone. This therapy is a voice for the fact that very serious illnesses are not the end of the road. It allows us to live our lives in the way that we want to.
Remodulin treprostinil injection. Indication, or what is Remodulin? Remodulin is a prescription medication used to treat adults with pulmonary arterial hypertension, PAH, WHO Group 1, which is high blood pressure in the arteries of your lungs. Remodulin can reduce symptoms associated with exercise. Remodulin was studied mainly in patients with NYHA functional class 2 through 4 symptoms. It is not known if Remodulin is safe and effective in children. In people with PAH who need to switch from epoprostenol, Remodulin is approved to slow the worsening of symptoms. Important safety information for Remodulin. Before you take Remodulin, tell your healthcare provider if you have other medical conditions or take other medicines that may affect your use of Remodulin by increasing the risk of side effects or decreasing the drug's effectiveness. Have liver or kidney problems. Your Remodulin dose may need to be adjusted if you have liver problems. Have low blood pressure or bleeding problems. Are taking gemfibrozil for high cholesterol, rifampin for infection, or other drugs that affect liver enzymes. Your doctor may need to adjust your Remodulin dosage. Are pregnant, breastfeeding, or planning to become pregnant. It is not known if Remodulin will harm your unborn baby or if Remodulin passes into your breast milk. What are the serious side effects of Remodulin? Continuous intravenous IV infusions of Remodulin delivered using an external infusion pump with a tube placed in a central vein within the chest are associated with the risk of bloodstream infections and sepsis, which may be fatal. Therefore, continuous subcutaneous SC infusion delivered just beneath the skin is the preferred type of delivery. Worsening of PAH symptoms. Do not stop taking or greatly reduce your Remodulin dose without consulting your doctor. Low blood pressure. Symptomatic hypotension. If you have low blood pressure or are taking drugs that lower your blood pressure, the risk of low blood pressure is increased. Bleeding problems. Remodulin may increase the risk of bleeding in people who take blood thinners, anticoagulants. What are the possible side effects of Remodulin? In clinical studies of SC infusion of Remodulin, most people experienced infusion site pain and infusion site reaction, redness, swelling, and rash. These symptoms were sometimes severe and sometimes required treatment with narcotics or discontinuation of Remodulin. IV infusion of Remodulin delivered through an external pump has been associated with the risk of bloodstream infections, arm swelling, tingling sensations, bruising, and pain. The most common side effects seen with either SC or IV Remodulin were headache, diarrhea, nausea, rash, jaw pain, widening of the blood vessels, vasodilation, and swelling from fluid retention, edema. These are not all the possible side effects of Remodulin. Call your doctor for medical advice about side effects. You may report side effects to the FDA at www.fda.gov/medwatch or call 1-800-FDA-1088. The risk information provided here is not comprehensive. To learn more about Remodulin, talk with your healthcare provider. Please see full prescribing information at www.remodulin.com or call customer service at 1-877-UNITHER, 1-877-864-8437.